Hi guys. Hi. Hope you're all good. Welcome to another episode of Fibro Friday. First of all, I need to apologize because I didn't post this last Friday, and appropriately, the topic for today is chronic pain, and one of the reasons why I couldn't post last Friday was because I was indeed in a lot of pain. So I didn't quite get around it, and I really apologize for that. But just for those of you who may not know what I'm doing now with the Fibro Friday videos, I'm just going back, sort of breaking down some of the key symptoms and other symptoms that we may have not explored previously in this series about fibromyalgia, and particularly ones that affect me or ones that I have particularly good knowledge about. So last one we talked about was chronic fatigue. Hopefully that gave you some insight into what we go through on a day-to-day basis. But today I want to talk to you guys about chronic pain. And I'm sorry, but I'm gonna use my little cow Mumu to yes, her name is Mumu, to keep me occupied here, because my hands and my elbows are actually in a lot of pain today. So finding places where to rest them kind of helps. Having soft things where to rest them on is even better. So, chronic pain. It's difficult to explain. Like with everything that has to do with chronic illnesses, and particularly fibromyalgia, I'm not going to tell you that my pain is the same than anyone else. It's not. But there are some general issues alongside the pain that we suffer that are more or less homogeneous amongst most sufferers from fibromyalgia. Chronic pain for us can have many shapes, but normally it is generalized. And it doesn't feel necessarily super intense or terrible all the time, but we can still feel it every single day, just nudging at us from some part of our body or even everywhere. Sometimes it can feel a bit like you have the flu, like, sort of general aches and pains on your bones, on your different joints, things like that. A bit like that. Sometimes it's a lot more intense. It can feel like a nail is going through you or through a particular part of your body. Sometimes it can be very specifically focused in a very significant place. It can be dull, it can be sharp, it can be pointy, it can be faint, it can be associated with tingliness and numbness as well, or it can just be straight up pain. Sometimes it can feel more like a muscular pain, like an ache, or soreness. Soreness is something that we tend to feel a lot, that we tend to refer to a lot, feeling sore rather than painful. But it can vary, and it depends as to whether you're having a good day, a bad day, the part of the body that hurts, or if it's all of it, who you are, how your sensitivity towards pain works. Sometimes the pain can come not just from a physical point of view, but it can be emotional pain, mental pain. I can't describe it much better than that, but as you know, our affections affect different aspects of our body. The physical affections are the easiest ones to sort of get across to you, but they're not the only ones. And sometimes we may be in pain because our neurons are trying to process so much information that our brain hurts. Like, the brain cannot hurt, right? It's impossible for the brain to actually hurt. This is why we have issues sometimes diagnosing, things that are in there, destroying our brains, destroying our gray matter and things like that. But it kind of feels like that. It's not just a headache. It kind of feels like something in here is about to explode. It doesn't necessarily feel like your head is tight, or like your head is about to fall off. It just kind of feels deep inside there is a pain in there, in your soul, in your spirit, in your emotions, that it's destroying you. So it's not just the physical pain that I want you guys to understand. It's that general soreness, that general ache, can be pretty meta sometimes as well. And it also has to do with the fact that, when you're living in pain all the time, it ends up affecting your perception of other things. I mean, the biggest issue that we have with fibromyalgia is because our neurons and our neuron receptors are more sensitive than others. Our perception of things are different. The way we feel things are different. So it kind of forms a loop that is just very difficult to escape, essentially. But focusing on the physical pain directly, I will use a couple of examples to try and get you guys to understand it a bit better based on like what I'm feeling right now, how I'm feeling right now, and a few things that have been happening recently. Okay? So, literally last Friday, I've been recovering from a horrible heat wave, which I'm sure you all have been suffering from, and the side effects from some antibiotics I had to take because you may have seen on my Instagram the Friday prior to that, after I posted my video about chronic fatigue, I was walking down the high street to find some ice cream. Something flew into my eye and it scratched it. It was hideous. And that was not just the fibromyalgia, that was an actual pain that was there that I'm sure many of you can probably relate to. But the day prior to that, I had an MRI scan. Now, in case you've never been in an MRI machine before, I mean, it's not a pleasant experience for anyone. I'm not special in that sense. But I had to go inside because they had to take a picture of my whole spine. And it was bad. I couldn't actually finish the scan because the amount of pain I was in. Why was I in pain? Well, they lay you down in this surface, which is plastic, is quite hard. So again, you're gonna be in a position that is not very comfortable, where your, shoulders are gonna be very stiff. They put my knees at an angle like that. So they were being forced into a particular position. They started flaring up very quickly. In order for you not to move, because you need to stay perfectly still, they kind of put like a plastic box around you. They put your headphones there so you don't move or you don't hear things. Then they wedge some things around it so you literally cannot move. Now, for those of you who've been knowing me for some time, particularly my hands and my shoulders can be really badly affected for the fibromyalgia. Already a bad thing. What happened was that after spending so much time there, on top of the box, they kind of put as well like a thing across your shoulders to make sure you don't move. That is very hard plastic. It was so bad. My arm started going numb. And this is what I mean when sometimes the pain comes associated with a feeling of numbness. First, you can sort of feel that you're not getting the feeling of them. It's because sometimes that sensation of pain starts blocking your receptors, and you don't know anymore whether that thing is there or not, if it's hurting, if it's not hurting, how much is it hurting, whatever. So I started feeling like I couldn't actually move my arm. It went all the way down, and then obviously my arm woke up and it was like boom, like someone had just grabbed a baseball bat and just smashed it. And I don't exaggerate. I mean, I've played baseball. I know the impact those things have, and it's literally like that. If you've ever grabbed a baseball bat and smashed it against something, even if it's just another piece of wood, it kind of felt like that. Huge impact here and radiating. Horrible. On top of that, I'm very sensitive to vibrations, and the vibrations started going through me, and it literally felt like nails were transversing my entire body. I can't put it any better than that. The vibrations were causing me pain. They were causing me discomfort. So it's, like I said, these kind of pains can be very different. It wasn't just the general aches and pains that I may get on a normal day. But because that pain was so intense and so different for me, that had some side effects that I was suffering on Friday. So when something went into my eye, everything else kind of just spiraled and caused other issues, other types of pain. So I've been having quite a lot of tension around my head for quite some time. And I've been sort of feeling that general achiness and soreness for the last week. My hands don't really deal well with the hot weather. My fingers really dilate, and obviously the dilation and the inflammation causes pain in the joints because it just puts more pressure on them. So it kind of feels like my joints are being stretched all the time, like put under a lot of pressure, or trying to be wedged between, I don't know, two very hard pillows constantly. That's what I'm feeling right now in my hands and in my elbows. So that's not the same type of pain that I was just describing you a moment ago, but all of these types of pain are related to fibromyalgia. On top of that, I get quite severe pain on my left leg. It radiates from my hip and my coccyx, and that literally feels like, again, it's a sharp stabbing pain. And then it radiates, and when it radiates, it becomes numbness. So those two things are quite associated in fibromyalgia. So as you can see, I'm describing soreness, which is different from sharp pain, which is different from feeling stabbed by needles, which I guess is sharp pain, but it's also very intense. And it definitely is not just about the sharpness, it's about the fact that it sort of goes into you. I've been describing this numbness that then can transform into very sudden generalized pain. Pressure pain is very common for people with fibromyalgia, and general aches and pains. So imagine living every single day of your life with one, if not all, of those. Fibromyalgia pain has been described by scientists and by medical practitioners who actually take this seriously as one of the top 10 pains that someone can experience in their whole life, alongside with things like rheumatoid arthritis and bone cancer and breaking a bone. Like, that's the kind of pain that we're talking about. And it's not just because of the intensity, it's because of its constant presence that really chips away from you. You know, it's not easy to ignore, even if you're on painkillers, even if you know it's not gonna get worse, because it's not degenerative, it's just constant. It's difficult to manage. Now, combine that with the heat wave, like I explained with the fatigue, they get associated. Heat makes things expand, your joints may suffer more. Combine that with the fatigue, it becomes quite difficult to manage them daily. Most painkillers that you can take probably won't even do anything to take the pain away. I can take paracetamol. Paracetamol does nothing for me. If I take ibuprofen, then it starts giving me problems somewhere else. So I have to be very careful with how I do this. I find massaging relieves a lot of the pain, but it cannot always relieve it. So it's one of those kind of situations where you just have to deal with it. Another pain that I suffer a lot from, and that is again, is quite a particular type of pain, and if you don't deal with it, it's very hard to describe, is jaw pain. And I mean, you know, like here. An associated symptom of fibromyalgia that I'm gonna speak with in the coming weeks is temporary joint mandibular disorder. So this here, that joins your jaw with the base of your cranium, it's very, very sensitive. It has a lot of ligaments and soft tissue there. I don't know if you can hear it, but that thing makes a noise now. It has since I have memory. And that actually means that there is always a lot of tension accumulating around here. So it causes not just pain for the neck and the shoulder, which is the reason why the shoulder is particularly bad for me, lots of tension, headaches, and also a lot of teeth and sinus pain. And eye strain as well, because all of this ends up radiating. So as you can see, there's many different types of pain that can be affecting people with fibromyalgia. It changes every single day, but it's always there. Even in good days, you can still feel it. There is going to be something that is not quite all right. So I hope that kind of helps you guys understand a bit more the type of pain that we have to deal with. I suspect at some point of your lives, you may have experienced some of these pains. So hopefully, if you try to embrace your own experience and translate that to how it feels day to day, without it having been necessarily caused by an impact, but just by being, then you may be able to understand a lot more what people with fibromyalgia and other types of chronic pain go through. Because we can't get rid of it. We can only just deal with it and cope. That's all we can do. And there is lots of things that you can do to help us out, like I've said in previous videos. Just, remember that we're a bit fragile, so treat us with care. And for everyone listening and that is suffering from the weather, please keep hydrated, eat lots of nourishing things, and stay in the shade. Have a good time. Bye.